Hello, I'm Dr. Gibson, and I'd like to talk to you about some options you have for plantar fasciitis. Now, plantar fasciitis is a very common problem that we're seeing in our office, and we have created some protocols and opportunities that allow multiple different treatments for plantar fasciitis. One possible treatment that people commonly will do before they get to our office is icing the foot and stretching. There are common stretches that can be done, which we are able to teach you and explain to you. The whole idea is the reason that plantar fasciitis occurs is because of a tight Achilles tendon. Basically, you take your heel, you take your Achilles tendon, and you take your plantar fascia. Now, the plantar fascia is a ligament on the bottom of the foot, and when they're pulling against each other, the weaker of the two is the plantar fascia, so it starts to get inflamed, painful, and tender, and can even start to tear off the heel. The Achilles tendon is significantly stronger than the ligament, the plantar fascia. So that's why the plantar fascia actually gets sore and painful. Now, as you stretch out the Achilles tendon, over time, it'll actually lengthen that tendon and alleviate some of the pressure on that plantar fascia and allow you to walk a little bit easier without pain. So stretching is a good idea to start, and it's a great idea to keep the plantar fasciitis from coming back once it's been treated and resolved. Other things that will commonly be done at home is anti-inflammatories, even something as simple as ibuprofen. So Advil or Motrin or even naproxen can be utilized to decrease the swelling and decrease the pain in that way. The icing, stretching, and anti-inflammatories is typically what people will do before they come into our office. Other things that can be done, you can be put into special braces or boots or things that allow that plantar fascia to heal, or even night splints that hold your foot at 90 degrees while you're sleeping to allow it to heal while you're sleeping. These also work very well, but the good news is there are treatments that can be utilized in addition to these or instead of these in some cases. So some of the other treatments that we offer in our office, you can get a cortisone shot. Cortisone shots in a lot of the areas of the body are considered temporary. In the plantar fascia, because of how it's done, the steroid is temporary because it decreases swelling over 4 to 6 weeks, but even sticking a needle in that area causes the plantar fascia to heal and causes it to resolve. So you can get 1, 2, or 3 cortisone shots to the heel and actually have the plantar fascia heal, but it may come back if you don't continue to do things necessary to help protect it or help it recover in a more permanent manner. Other things that we offer in our office, there is a new form of laser that can be utilized for this. It's a two frequency laser. It actually switches between 2 frequencies relatively quickly. One frequency is designed to decrease swelling and decrease pain. Again, taking away your superficial symptoms, taking away the discomfort that comes with it. But it also has a second frequency that treats the plantar fascia at the cellular level to cause healing. And this is very valuable and very worthwhile in alleviating plantar fasciitis. The other option that we like to mention to individuals is toe pads, which is a specialized procedure, specialized surgery that's done for this. Now, surgery typically for plantar fasciitis is only 50% effective. So most of the surgeries that you'll read about or see all over the internet don't work very well. So we recommend you do all the conservative treatments first before you do surgery. Now, toe pads is completely 100% different. We're getting 80 to 90% effectiveness, and it's a surgery that's done through pinholes. So instead of having an incision that you have to wait to heal, or instead of completely cutting the plantar fascia that forces you to be off your feet for 2 to 4 weeks, you can walk on this day 1, you're in a special shoe for 2 days, you're back in normal shoes thereafter with the pain improving over a 2 to 4 week period. What it is, it's utilizing a specialized wand that uses radio frequency waves to create mini tears in the plantar fascia, to stimulate neoangiogenesis, which is growth, new blood vessel formation, and growth factor migration to allow healing. So between the stretching, ice, and anti-inflammatories to take away initial symptoms, the specialized splints or boots that can be utilized as necessary to allow better comfort when you wake up in the morning, or more aggressive treatments like cortisone shots, the MLS laser, or the toe pads. All of these are designed to help fix the problem. Now, one thing you should never forget about is there's a reason that you're getting plantar fasciitis. So it's worth getting evaluated once the pain is resolving to determine if there's additional treatments that are necessary to ensure it doesn't come back. One of those being specialized orthotics or inserts for your shoes that will change the way you walk with the goal that you can continue to be active, continue to do what you want to do, and not have plantar fasciitis return. Thank you.